Okay, hello everyone. I think you can hear me well. I think we can start now for this new Tuesday Connect session. And now, without transition, I will let the floor to Sofia and Amy from Work Package 8, who will present the JAMREYE dashboard.
Great, thank you so much. I let you share the slides, Sofia. Again, thank you for being here today for the Tuesday Connect. We are coming from 8.1, which is focusing on strengthening AMR surveillance across Europe. And with this, we want to present a bit more about the JAMREYE dashboard. I'm joined with my other colleague Baptiste from LNS and our colleague Sofia and Julius from the Public Health Agency of Sweden, and Moira Kelly as well from Cienzano. And for today, we have quite a nice agenda. We are going to start by doing a bit of an overview of the JAMREYE dashboard that we have developed, the aim and purpose that went into this development, how it can be used for identifying European surveillance gaps, and then some insights that we have for ongoing developments and where we are moving forward with this tool. And then the second part of our talk is really from data to action. So how we can use the dashboard for really implementing and strengthening surveillance systems. We have 3 country examples: Luxembourg, Belgium, and Sweden. And then on the right, you can see kind of our core team coming from the Public Health Agency of Sweden and the LNS, the National Health Laboratory in Luxembourg. And then this is also only made possible with the support of the 120 partners and the 30 countries that have been contributing great data into our work.
Thanks. So we wanted to start a bit and talk about why we created the JAMREYE dashboard in the first place. So we felt that Europe was lacking a space where we could get an overview of national AMR surveillance, what surveillance is ongoing in each country. We also felt we needed a place where we could follow up country progress for surveillance, but also especially towards policy commitments, because there's a lot of policy commitments, as you all know, relating to AMR. And why this is actually particularly important for surveillance, we think, and why that is because in the 2023 Council recommendation on AMR, there has been reduction targets set for Europe and for all countries. And you can see them here, the general targets. The thing with this for surveillance is that we work with improving surveillance, and that might mean that for some countries, if we collect more data and actually improve surveillance, it can lead to increased resistance. And this means that countries that are actually doing something good and doing what they're supposed to do and making surveillance better might come out looking bad if we set like incidence targets like this. So we really need some sort of context to surveillance so that we can show sort of country progress, even if these targets are not met. To approach this, we aim to build a framework and a tool that can present, first of all, the European surveillance landscape, which can also help to support to identify gaps, both for countries, but also for Europe as a whole. And we also wanted this tool to be able to highlight progress towards policy commitments. So what we did was that we performed an inventory of national AMR surveillance across Europe, and we built and launched an interactive dashboard to show the results, which is JAMREYE. So here you can see just a snapshot of JAMREYE. It's quite like a classical dashboard, what you would expect. You can find all the questions that were in the inventory, and you can use filters and tabs to sort of customize your view and decide on what you want to see and focus on. We have 30 countries in this dashboard, which is amazing. It's all the countries in JAMREYE. we also have information on 5 culture materials and 8 bacterial priority pathogens and 12 resistances. And these are in the filters here to your left, so you can sort of find your favorite pathogen and see how is your country surveillance for that pathogen compared to other countries in Europe. So the target group for this is policymakers and surveillance experts, with a bit more focused on right now on surveillance experts, because you need a little bit of knowledge to be able to use the full potential of the dashboard. I also want to highlight that JAMREYE is not EARSnet. We don't have actual resistance data in this, but we have information about how surveillance is conducted. And ECDC is a very important stakeholder for us, and we work closely with them both when designing the inventory, but also now when looking at the data and discussing where to go from here. So just to give some example of surveillance gaps, this relates to whole genome sequencing that you can find in the dashboard. That is something that a lot of countries need to work on. So here is the first example. It's a question that we had on which national expert and reference labs that can use whole genome sequencing in real time, which means that the results can be used for IPC purposes, for example. And we can see here that it's quite a divided picture in Europe. Some countries have implemented this, others are doing it, and but quite a lot of countries are not doing this. So this is also an opportunity for us where we can work together on how to approach this. Another part is the possibility for joint whole genome sequencing analysis between national expert lab and another sector, which is really a core thing in JAMREYE since it's One Health. And as we see, this is a very, the picture in Europe that we see is that most countries do this, they can do this, but only 3 countries have set up like an official data sharing pipeline and method for this. And here, this is also a great opportunity for us to look at what is it that these 3 countries are doing that we can sort of do as well and help like approach this together. We also wanted to be able to follow country progress towards policy commitments to create sort of baselines. Where are we now and how can we what is left for us to fulfill these commitments? And of course, the main then policy document being the council recommendation. So I'm going to show one example of this. So we take a policy commitment, for instance, that pathogens resistant to last line treatments should be notifiable according to national communicable disease legislation. This is from the council recommendation. So then we can pull the data because we have asked this question, what is notifiable or mandatory? And we can like build sort of surveillance landscape pictures with this data. So please don't, you don't have to, understand this picture in detail, but the idea here is that we have all the countries on the y-axis and then the pathogens with the resistances on the x-axis, and then each panel is a culture material. So then we can see that, for instance, the dark green here, it means that a country has that pathogen under mandatory surveillance. A turquoise is that it's under voluntary surveillance, and the gray parts are that there's no surveillance. And then we can look at this map and sort of discuss where do we want to go with this, and where do we think we need to go to meet this commitment, because it's not about making everything dark green here, because that will not be possible, but to just see what do we think is most important to move here, and it will differ also between countries. So, but we definitely see that this is something we need to work on to improve on that commitment. And it's not something that's simple, but it is something that we can do together, because we're all sort of in the same boat when it comes to this, that we have all signed this commitment. So this is one example, but we also have other examples that we don't show here today that relates to other policy commitments. For instance, the expansion of European surveillance to include more culture materials, or to strengthen the use of surveillance data to improve patient outcomes. So this is a little bit where we are right now. We're looking at the data, we're trying to find these that we call targeted actions, where do we go from here? So there are plans to also turn this into a roadmap and initiate work on how to sort of approach these European challenges that we have. We also have capacity strengthening activities being planned. This is led by Denmark, SSIDTU, that you will hear more about this in the future. We are also working on improving the dashboard, and we are also planning to recollect data to sort of show progress recollect data in 2027 and also see how we can then show progress. So we want to stay a little bit with this part, so I'm going to hand over to my colleagues Julius and Baptiste to talk about this.
Yes, thank you, Sofia. Yeah, so one of the current developments for the dashboard is actually to go from presenting data to presenting insights. And the idea there is to provide the user more contextualized survey results. And this is not online yet, but soon there will be this Insight tab that you can see here on the left-hand side that leads you to a more contextualized overview of the results. Here's an example for the national surveillance of AMR survey priority pathogens. And the idea here is to enable actionable decision-making for the user by really showing the results of the survey, but also putting it in context and allowing some dynamic exploration of the data. If you click one more time. Yes. And in addition, it allows to compare selected countries head to head to see where is your favorite country compared to another one. Yep. Baptiste.
Yes, thank you, Julius. Hello, everyone. So I will quickly talk about what's the plan for the dashboard for the integration of the next data collection. So as Sofia said, it is planned for 2027. So we will first add a new filter in the panel of the filter panel of the dashboard in order to allow the user to choose between one or another dataset. Of course, if we make other surveys later, we can add those ones as well. So here on the left, you have the current version of the left panel. On the right, you have what it can become. So we will add this filter to choose between one specific year or to see the evolution between years. And we will move the dashboard versus insight toggle switch in order to have a logic hierarchy between the different filters. Next slide, please. So to explain briefly how it could work, of course, this is just a draft. It's not, well, it might change until we release it, but it's the current ID. So we have one switch to choose between a dataset, one switch to choose between dashboard and insight. So if we choose one single dataset and the dashboard, you will see the dashboard as it is now. So with the possibility to go through every question one by one and see the results. Then in the case you want to see the insight, you will see what Julius explained just before. So, but focused on 1 year. So just below, I put a little Venn diagram to explain that the surveys might be slightly different from 1 year to another. So by choosing a single year, you will see all the questions from one single year. Yeah. And then on the right part, by choosing the evolution button, you will be able to see the progress from the first survey to the second one. So by choosing evolution plus dashboard, you would see a graph showing the before and after. And by choosing the insight, it will show you more like the highlights and the summary of the progress over time. And as the survey might be slightly different, you will see only what is common between the 2025 and 2027 surveys. Next slide, please. Yeah, so in summary, what's on the dashboard now will remain. We will not remove anything by adding new surveys. We will not replace the current data, of course. We will add one more tab for each new data set and new pages to see the evolution between those data sets. And the Insight tab will be used then to highlight the evolution. And as I said, it's only a draft plan, but we can, of course, change our mind and make things different in the end. But yeah, that's it. Thank you.
Great, thanks, Baptiste. So now we're going to move into the next fun section, which is the country examples. So how really all 30 JAMREYE countries can actually make use of this dashboard and the data that they provided and turn this into action and implementation. I will start with the Luxembourg example. So before I kind of get started into how we identified the actions to be taken, we thought it was important to put some context and to explain how we got there. So for starters, Luxembourg is a very, very, very small country. We have a population of about 700,000, but at the same time, it is a high resource setting. We have advanced digital infrastructure and accessibility. The involvement from Luxembourg within the JAMREYE project is solely our institute, the LNS, which is the National Health Laboratory. And although we operate under the umbrella of our Ministry of Health, we are not the ministry nor the authorities. And I highlight this because we had to really think about what is feasible from our end, since we are not really the ones to change our communicable disease laws and say which pathogens should be under mandatory surveillance, etc. But at the same time, as I mentioned, we're the National Expert Lab for AMR, and so we could focus kind of what we do in our center into improving our own national surveillance system. In this regard, we identified our path to strengthening surveillance centered around two components. The first is the use of the AST and surveillance data that we produce at the expert lab into improving treatment guidelines at the national level. And then the second part is really around increasing our whole genome sequencing capacity. This includes both expanding to real-time investigation for outbreaks and strengthening our joint analysis. And if you go to the next slide. So for our first task, as I kind of just mentioned, we identified that the use of surveillance data is really an area that could be improved at the national level. As you see here in the snapshot of the JAMREYE dashboard, countries were asked whether or not they had national guidance for empiric antibiotic treatment. There were a variety of different sources that countries could report that go into these guidelines, including, for example, routine or extended AST data or even international AST data. But for Luxembourg, unfortunately, no AST data is actually being used for writing these guidelines. And so this is something that we kind of identified as being important. In this map here, I also want to highlight that if your country is red, it's actually a good thing. Because it shows that you have other data sources going into writing your guidelines. So if you click again. So in Luxembourg, there's no AST data being used for writing treatment guidelines. And click again. So to support the recommendation D, 11A and 13, which is more about again, using surveillance data to boost AMS, for example, we identified that creating a structure that would allow a feedback of our surveillance data that we create in the lab into the national guidelines is something important and something we want to tackle in the context of JAMREYE. If you click. And so now how are we going to do this? So the first is really to highlight the gap to our national stakeholders and those responsible for writing these guidelines. and then deliver and integrate a concrete plan for use of our data into these guidelines. And of course, this is really easier said than done. However, we are part of this huge consortium. We have a lot of support in this, and we're really hoping that taken together, we're able to kind of push this forward, since it is a little bit of low-hanging fruit and something that really should be pushed forward. And the next slide. So the next thing that we identified as a gap was the use of whole genome sequencing in real time for outbreak investigation. This is again something that Sofia kind of already touched on. There's many countries that 47% of countries don't use whole genome sequencing in real time, and this includes Luxembourg. And as the LNS is our national expert lab, we're actually the only laboratory in Luxembourg producing whole genome sequencing data for AMR. And we do luckily have the resources and infrastructure in place that could help us expand our platform to include real-time outbreak responses. And then if you click again, Sofia. So to support, again, the recommendation B5, which is using data in a timely manner, we identified that pushing for having this set up and use at our national expert lab is really important. If you click again, the task that we kind of identified as being the way forward to achieve this is, well, first to expand our infrastructure at our own institute. But then again, we really need to go back to our national stakeholders and highlight this gap. And because even if we have everything set up from a technical point of view, there's a lot of collaboration needed from the hospitals, there's collaboration needed from treating physicians, and as well the support of our health directorate to actually get these things in place. So from here, we're also aiming to improve our data systems and how our labs share and collect data from hospitals and authorities and communicate it back. So lastly, the last kind of task with this would be to establish a really concrete SOP for the integration of the workflows, so that when an outbreak arises, our lab is ready and prepared. So hopefully we can see this, we can turn green in the future with this. And then to go on to our last task that we plan to tackle in the context of JAMREYE, it's again something that Sofia talked about in the beginning of this presentation, and it's really more in line with the previous task for whole genome sequencing, is something that we would like to strengthen our surveillance system with, boosting joint analysis with other sectors. A lot of countries, and you can see from this snapshot in the dashboard, are in green, and this means that they have some form of joint analysis or sequencing data shared with sectors, but it's unofficial. There are 3 countries in JAMREYE that have an existing pipeline set up for the sharing and analyzing of data. In Luxembourg, we do perform One Health surveillance, but it's limited really to foodborne pathogens. And although our collaboration works really, really well, it's completely unofficial. And if you click again, Sofia, again, so to support the recommendation B5E, which is about setting up integrated systems, we identified that really officializing our data sharing for joint analysis and boosting it even more is something that we can tackle in the context of JAMREYE, and we have the resources to do this. If you click one more time, how we plan to do this is to first officialize the ongoing work that we're already doing through a collaboration agreement between our institute on the human side, plus the animal and veterinary lab and our health directorate, as well as potentially including in the environmental surveillance. And I can really say that by having a proper working agreement in place, we can really expand our work to also include hospital-associated infection, not just foodborne pathogens. And what we are also actively working on in this context is building a national plasmid reference resource for One Health surveillance. So this is work really done in the context of 8.1 for the human side, because at the moment it is not existing, but it would also link in with 8.4 for One Health surveillance. And our main goal with this task is really to be able to link the characterization of plasmids and tracking, and how this can make use of outbreak investigation. We think for boosting our surveillance system, this is kind of the path that we've chosen. So I hope this is one example for you. We're going to move on now to the Belgium side to see what they have going on.
Hi, can you hear me okay? Yeah, fantastic. Hi, so I'm Moira Kelly. I work at Cinsano, which is the Federal Public Health Institute in Belgium, and I'm going to give you a brief overview of one of the activities we're doing to try to improve our national surveillance of AMR. So again, a little context. We are not quite as small as Luxembourg, but still a small country, but we have a really highly fragmented surveillance system. So even just covering the 10 pathogens covered by the JAMREYE dashboard, we have 6 completely independent surveillance systems that hospitals all have to independently input their data into. And in some cases, there's quite a lot of overlap. So they might be inputting the data about the same infections even into multiple different systems. So I've outlined this a bit on the right. And one of our main tasks that my colleagues in Cinsano are working on is to try and harmonize our national surveillance systems, which are really listed in the left hand of the 2 columns, with our slightly extended European surveillance system. So we only have two, but collective together surveillance system, which is the peach system, peach colored here, which is on MRSA and multi-resistant gram-negative bacilli. And really the challenge here is that it is mandatory. We have nearly 100% coverage, but it's all samples which are the data is collected together, aggregated. So we have no idea on patient level information, or even what type of sample it was. Was it from an invasive infection, or from a urinary infection, gastrointestinal, etc.? And parallel with this, we collect data for the EARS-net, but we have a slightly extended program where we collect not just invasive samples, but for some pathogens, we also collect urinary samples. But here it's voluntary, and actually we only have about 40% of hospitals participating. We also have some labs outside of hospital settings, but we really see, because there's quite low participation, the sort of geographical and population coverage is questionable, and so how well you can interpret these results on a national level is questionable. Next slide, please, Sofia. And what this means when we look sort of at our JAMREYE dashboard is that while here I've shown the 2 maps for third-generation cephalosporin-resistant E. coli, but it really applies to a lot of the pathogens. That on the top, if you say, do you have a mandatory surveillance system? We say yes, and we have very high coverage, normally 90% above, but we have no patient level data. And so when you look at it for a specific system, so below it says, we watch your coverage in terms of urinary tract samples for E. coli, and we say actually we have quite low coverage, because to know that the samples are coming from a urinary tract, we only have it from our voluntary surveillance system, and then we only have about 40% coverage. And next slide, please. So of course, an obvious improvement is to harmonize these 2 data collection systems, so that hopefully we get the advantages of our national surveillance system, where we have very high coverage, but with the disaggregated benefits of the European type data collection. This is of course an obvious improvement that we've been trying to make actually for a period of time. A significant challenge is that for the hospitals that don't already participate in our voluntary surveillance system, this represents quite an increase in workload, because submitting data on a patient level is a lot more work than doing it aggregated. We've been looking into trying to semi-automate the data collection, but we face a real challenge, because we have this very segmented healthcare system, where we have, for example, around 100 acute care hospitals, and these 100 hospitals use more than 80 different computer systems. So trying to develop an automated data collection that is aligned with 80 different software systems is very challenging, in a federal institute setting where there's obviously limited resources. Next slide, please. And so this is a development that we've been trying to work on, and we really hope to tackle in the next couple of years. But I think for us, the real benefit of the JAMREYE is that we're grateful to have this additional context, as Sofia was saying, for our results. I think maybe other countries are in a similar position, where there's a lot of discussion and to some extent political pressure to try to meet our European Council recommendation targets that Sofia already outlined. And these are really discussed and very actively. And the challenge is we do see very different, well, not very different, but in some cases very different resistant levels between our mandatory and our voluntary surveillance programs. And so the challenge is that as we increase and improve our coverage, that of course our results are going to change, and being able to provide that context, both for our national politicians and also on a European level, I think is going to be really important for Belgium in particular, and I can imagine for other European countries as well. So that was a brief overview of one of the activities and where we can really see an added value of the JAMREYE dashboard and this updating of it over time as well. So thank you. I think I'll pass to Sweden.
Thank you, Moira. Yeah, I would like to give you a glimpse of some development work that we are doing in Sweden. Next slide, please. Yes, and here we are focusing on improving our One Health report, Svedde and that has been published annually as a physical book and a PDF together with the Swedish Veterinary Agency. And yeah, this is actually in line with the results that we've seen from the survey here, that among the turquoise countries here, 80% are actually publishing their AMR results in a non-active, non-dynamic form annually. So our approach to overcome this is to do this year's report in a bit more modern and digitalized format that is based on, next slide, please, on R, so the scientific or the statistical programming language, and Quarto, which is a open source technical publishing system that is super integrated with R and other programming languages. And this enables dynamic updates of a report. If there's new data, it's easier to update and to release new versions. Yeah, with these advantages of being like more dynamic and easy to update, there are also some challenges because this is script or code based. We need to kind of establish new processes internally to actually be able to do that. But I think in the end, this will become a really nice report and can also be a good example how to constantly update or easily update AMR reports, for example. So yeah, when everything goes well, this will be out before midsummer. So let's cross our fingers. Yeah, next slide, please. Because with that, we've come to the end of the presentation. And if you'd like to know more, you're more than welcome to contact us via the contact form on the dashboard side or the email addresses that you've seen in the presentation. And also, if you would like to get involved, contact us. We're more than happy to get more hands into this. And yeah, with that, thank you. And I open the floor for questions and comments.
Thank you everyone. Thank you, Sofia, Julius, Baptiste, Moira, and Amy. It's for this really good and complete presentation. I think it's important to see the work behind this dashboard, because honestly, it's a really great tool that you can visit online. I've put the link in the chat if you want. And yes, now if you want, you can raise your hand or put your question in the chat, so don't be shy.
I think
Yes,
ask Julius a question or like to comment on one thing, because we're having quite relating to this change of report format. We also have to mobilize a lot of our epidemiologists that are currently working in Excel to R. So this is a very exciting task, I think. Can you just comment a bit on that, Julius? Because I think a lot of other people are maybe in a similar situation.
Yeah, that's a really good point. As Sofia pointed out, some of the work that is currently but that my colleagues are currently doing is really manually and labor intensive, and can also be prone to errors because it involves a lot of copy pasting and Excel work. But given the trend that new EPIET fellows, for example, or other epidemiologists are trained in R, I think there's a great potential to get to transition to a more standardized and code-based analysis workflow. And yeah, but as Sofia also mentioned, this requires a bit of collecting enough energy and willingness to do this transition. Yeah.
Thank you, Julius. We have two questions in the chat. Do you have insights in your coverage, and do you know that you do not report certain systems, for example, regional surveillance?
Yes, okay. I understand. That's a really good question. No, I mean, we have tried to we focus on national level. So we have said like this, we have asked about the data that is available at national level. So there might be systems in countries that do not report to national level, or like more regional systems, and those we don't cover them here. So we only covered what is seen at the national level. Was that your question, or?
I think also like to go on that, I don't know, Rosemary, but we only cover a certain part of surveillance. So we could not cover every single pathogen or resistance or etc. We had a really clear focus on AMR priority pathogens as well, that are more in the healthcare associated infection, as this is the greatest burden for AMR, but also we really wanted to be able to focus on the extensiveness of culture materials and resistances. And if we had added every single pathogen, it would have just been impossible. So our idea was to go more in depth of a few things so that we could really get a better idea, rather than covering everything that could be covered for surveillance.
Thank you, Sofia. Thank you, Amy. We have another question in the chat. Is another round of survey planned to monitor if policies and practices in countries change by the end of the project?
Yes, it is. So how we plan to do this is that during the fall 2026, there will be an evaluation of the questionnaire. And then it's also possible for you, if you feel that you are missing things, or that things are unnecessary to have in the questionnaire, I mean, you can comment on that in the evaluation, and we see how we can adapt and improve the questions that we have. And then spring 2027, so in 1 year, we will send out the questionnaire again and recollect all the data that will then go into the dashboard, a little bit like Baptiste explained, so you can see both the new data set, but also the evolution and how things have progressed or not progressed. We will see. So we have sort of a follow-up. Our plan is to exit JAMREYE with a fresh follow-up study, or yeah.
And this is why also, I mean, what we're actively working on now that the dashboard is set up is to push a lot of our partners to make sure that when we recollect data, there's some improvement in the next few years, and we can see some of these reds going to greens or etc.
Last question. Maybe you can reflect how other countries. I don't know. Oh, I can't see the end.
So for following up on the gaps, yes, Elena, thanks. So this is something we're actively doing. We're reaching out to countries that are within the 8.1 group that may or may not have quite some funding to make changes and implement actions into this. And we have identified our 3 kind of main indicators that are based on the 2023 Council recommendations, like Sofia pointed out, in the targeted actions. And this is something that we can actively sit down with countries and say, I mean, the dashboard is something you can interact with very easily, and this is something that they can identify the gaps, and then when we recollect data, we can follow up on the progress of these gaps.
Yeah, I agree. And I think we have spent now time to develop this dashboard. So I think also the next 2 years will be quite focused on how to support partners, to sort of what support the partners need to move. And I think also what you said, Emmy, was really important, that not everyone can move the same things because we are in different institutions and we have different capacities. But there will for sure be things that everyone can work on from their perspective in this. And the dashboard is there as a support.
Thank you again, everyone, for this presentation of the JAMREYE dashboard. And I suppose this is it for today. Thank you, and see you next Tuesday or next month. Bye, everyone.